genitourinary tracts. And some genus are important, such as Bacteroides, Fusobacterium, Parabacterium, Porphyromonas, and Priotella. And among them, the Bacteroides, especially Bacteroides fragilis, is more important. The shape of these bacteria. Almost these bacteria are very small, and sometimes these bacteria are lined rods. And these bacteria stain weakly with the gram staining. I think some of you have had lab class in the past, yes or not?
Yes, yes.
Yes. Do you know gram staining?
Yes.
Depend on gram staining, bacteria classified to groups: gram positive and gram negative. Anaerobic bacteria, the gram negative anaerobic bacteria, stain weakly with the gram staining. Therefore, sometimes we cannot see anything on this slide. Do you understand? You cannot see anything in this slide. I said that Bacteroides fragilis is the most important species in this group. Okay? And these bacteria also has lipopolysaccharide. You know, all of the gram-negative bacteria have LPS, lipopolysaccharide. Okay? Do you know endotoxin activity is related to which part of LPS? Lipid A, yes. And because in Bacteroides fragilis, lipid A have a different structure, therefore, in this bacterium, LPS has little or no endotoxin activity. I said that all of gram-negative bacteria have endotoxin activity, yes? But Bacteroides fragilis is gram-negative, but because of different species, has little or no endotoxin activity. And also one of the characteristics of the Bacteroides fragilis is that this bacterium has a polysaccharide capsule. Okay? Two important characteristics or properties of Bacteroides fragilis. Okay? No or little endotoxin activity and polysaccharide capsule. Important in your exam. This is why. In general, pathogenesis of anaerobic gram-negative bacteria are at first capsule, such as Bacteroides fragilis has capsule. Second, Fimbriaria. Do you know the role of Fimbriaria in the bacteria? Or pili, huh?
No, just so there is no
How many trees, how many Fimbriaria? Okay? Bacteria. Surface of the other cells, such as host cells. In pathogenesis, attachment of bacteria is very important. Okay? And Fimbriaria is used for attachment of of bacteria on the surface of the host. And succinic acid is a chain fatty acid that anaerobic gram-negative bacteria produce it and is used for inhibit phagocytosis and killing by other intracellular bacteria. Okay, you understand? Are you sure? Another here, I ask you another virulence factors is IgA, IgM, IgG proteases. Do you know IgA, IgM, IgG? What is immunoglobulin A, immunoglobulin M, immunoglobulin G? Do you know? Huh? Or not? Not? Yes or no? Yes? Thank you. Please answer me yes or no. These bacteria can produce an specific enzyme is proteases. The proteases can destroy these immunoglobulins of the host. Therefore can cause disease. This factor is a virulence factor. And also tolerate exposure to oxygen. These bacteria are anaerobic, but some of them, because of production, some enzymes such as catalase and superoxide dismutase, they can tolerate the oxygen. They can tolerate the oxygen. And also some of them produce toxin, such as Bacteroides fragilis can produce toxin. Toxigenic toxins, especially in the cloud, and Bacteroides fragilis, because of this toxin, can cause diarrhea. In summary, anaerobic gram-negative rats have several virulence factors, such as capsule various succinic acid, proteases, some enzymes such as catalase and superoxide dismutase, and toxin. Which diseases are related to this bacteria? At first, respiratory tract infections. These bacteria can cause respiratory tract infections. These bacteria, such as Bubonella, Porphyromonas, bacteria, and non-fragilis bacteroides. Other bacteroides, not Bacteroides fragilis. And respiratory tract infections is occur in half of chronic infections of the sinuses, ears, and all periodontal infections. That means after infection in all the respiratory, such as ears, sinuses, okay, and in the mouth, periodontal, by anaerobic bacteria, maybe the respiratory infections is started. Do you understand? Brain abscess. this bacteria can cause brain abscess in the brain, and the anaerobic infections of the brain are associated with chronic sinusitis and otitis. If a person have anaerobic gram-negative infection in sinuses or in his ears, if the treatment have not done completely, may lead to brain abscess. Which bacteria such as Purotella, Porphyromonas, Fusobacteria, and Peptostreptococcus. Intra-abdominal infections, the most common organisms which cause the intra-abdominal infections is Bacteroides fragilis, and gastroenteritis. I said that some of the Bacteroides fragilis can produce enterotoxin. Okay, enterotoxin. And another group cannot produce enterotoxin. The Bacteroides fragilis, which cannot produce enterotoxin, is in normal flora in the colon. Okay? As a normal flora in the colon, microbiota. But presence of enterotoxic Bacteroides fragilis in the colon cause the gastroenteritis. You know that this disease is self-limited. I said most of diarrhea, for most diarrhea, we don't use any antibiotic therapy. We say that these diseases are self-limited. And in children younger than 12 years, almost we see these diseases. Another disease, infection in female genital tract, such as pelvic inflammatory disease, abscess, and endometritis. And we say that gynecology infections. Mixture of anaerobes can cause this disease. The most important is bacteria, is Purotella,